How does hiccup happen? We feel hiccup when we laugh excessively, take food hurriedly, have indigestion, take very hot food, etc. When we have some disorder in the diaphragm or the nerve that goes to it, diaphragm contracts rapidly, and to prevent this contraction, the uvula closes. This we experience as hiccup. It is not a disease. But hiccup does occur when the muscle that separates your chest from your abdomen and plays an important role in breathing. This involuntary contraction causes your vocal cords to close very briefly, which produces the characteristic sound of a hiccup, and more often among those who are affected by meningitis, pneumonia, uremia, etc.